You know what this is? This little guy? It's a little antacid tablet. People chew them up to reduce acid in their stomach. When you reduce acid, lots of things happen. When you reduce acid, you don't absorb nutrients as well, especially B vitamins. People always think like they have a low B12 level. That's just going to be an energy thing. I'll go to the doctor, get a shot, I'll feel better. Well, that's a really good solution. That works really well. But if you're taking antacids, you reduce the acid in your stomach and you don't absorb foods as well. People don't take antacids all the time. They'll munch one up, or 2 or 3 or 5 or whatever, or drink some antacid solution and calm down their stomach and reduce the reflux. That's great once in a while. It's fine. But people who take medication, they're called H2 blockers. They're the old class of drugs, or proton pump inhibitors. They're ulcer drugs. When you have reflux or ulcers, you take those drugs, and doctors use them really regularly. Preoperatively, doctors give them as a preventive because they really help to not create an ulcer. Stress causes ulcers. Do you know anybody who's under stress? Of course. So there's lots of this going on. So PPI, proton pump inhibitor, or H2 blockers cause a sustained release or reduction in acid. A low acid level makes your body very, very weak at digesting and absorbing, especially B12. So how would you know? How would you know? Well, you're tired. You can be tired from a million reasons. There's lots of reasons you can be tired, but specifically, numbness, tingly, funny feelings in your fingers and toes and your tongue, that can be B12 deficiency. The other thing is your blood count will show what's called macrocytosis. Micro means little, macro means big, cyto is a cell, so you get big old fat cells because there's not enough B12 for them to be tight and snug the way they should, and it shows up in your blood count. You can do a B12 level, that's helpful, but a B12 intracellular level is even more valuable. It's a little more expensive, it's a little more involved test, but if you're taking a proton pump inhibitor or an H2 receptor agonist, then what's going to happen is that your acid levels will be low, your digestion will be affected. So if you have to take them because that's a life-saving thing for you, you have to nutritionally supplement. Some people intravenously because you got to bypass the intestinal tract problem because you have no acid. Acid actually creates activation of enzymes. That's what digests proteins and fats and carbohydrate and everything. So maybe you're not even digesting your food very well because of that. So if you look at the digestive function and then think, how can I improve the digestion? Then maybe take enzymatic therapy, which is different than probiotics. Enzymes are the proteins that break down food. Probiotics are the good bacteria. You can take L-glutamine to heal the intestinal tract. Mastica, which is a gum extract, sometimes that's all you need. But if you're in trouble with your intestinal tract, get with your doctor, get on a PPI if you need it, get a proton pump inhibitor, get on the medication that you need, support your nutrition in the meantime. You can do it orally or under the tongue is really good because you bypass the intestinal tract as well. And in our office and other doctors' offices, intravenous or intramuscular vitamin therapy is very appropriate when there's an intestinal tract problem. But you should know, when you're taking medicine for your stomach, you may undo your digestive process and get sick from it and not be as well. So always pay close attention to that connection between change the stomach, you change your digestion and absorption, and you're going to change your nutritional status. Pay attention. If you don't feel great, get with your doctor. We're better together.